Today I'm honored to have someone who I've known for some time. His name is Alex Fair. He's the managing director and CEO of Medstartr Ventures. I was going to say founder of Medstartr Ventures as well. I attended one of your conferences a few years ago, so I think that's how I had met you. The one at the JP Morgan Chase building.
Yeah.
Um, so Alex Fair is he was, while working on his PhD in pathology at the Medical College of Wisconsin, Alex took a break to found his first healthcare startup. That company was bought by a company that had just gone public, and he has never looked back since, starting new companies and running them. He still wants to cure cancer and fix healthcare. I think we all do. But now he does so by enabling hundreds of new companies to get to market faster and more reliably. He also has served as an advisor or mentor to over 120 startups. And so I guess in 2017, you founded Medstartr Ventures, right? And right. And since then, you've been looking to work with the best and the brightest companies, right, Alex?
Mm-hmm.
Awesome.
That's my bio.
Thanks for being here.
So thanks for having me. And it's always so wonderful to see new people coming into the space or just know a lot about medicine, know what they're looking at, and just want to learn more and bring more information out to the public. So thank you for doing this. It's wonderful.
No, thank you for having me. I mean, I think that there's been a lot of interest in healthcare tech, but I think a lot of physicians don't know how to get involved. And I think it's also a great way to kind of fight burnout in medicine. So many of us are just like in a rut at times, and we don't know really how to find other ways to address our issues and our concerns in medicine. So for me, it's definitely been something that's been super fun to do. And also I got to meet cool people, and I get to kind of see what's coming through the pipeline.
Absolutely. And you're, one of the 4 key stakeholder groups in healthcare innovation. I mean, without having the expertise and the knowledge of actual care delivery and medicine, a lot of these new ideas would just be new ideas, uninformed by the actual clinical situation and how they'd be implemented. And they wouldn't make doctors' work easier or better or more effective. So I mean, you guys are critical for any of our innovations to be successful. And I would say about a third of the startups that come through our doors that we work with or we help are founded by physicians. And one of the things I always say, so if you look at my recorded history, you'll see Alex saying this all the time. So one of my trademark phrases, which is, we didn't go to med school. I'm sorry, I didn't go to med school. We went to med school and grad school. See, after saying that preamble, then I mess up the line. We didn't go to, we went to med school and grad school, not B school or work on Madison Avenue. So a lot of times when a scientist or physician founder, is trying to bring a product out to market, we have no idea on how to package it, how to set up a business and things like that. And I'm no different. I was a PhD student for 3.5 years. I was going to go to med school, then I started a company and it blew up. And, what do I know about running businesses? But I learned. So, and now I teach.
Yeah, that's awesome. So, I know we've talked a little bit about Medstartr, but tell us a little bit more about why you founded it and kind of, how you came about that.
Well, so Medstartr first and foremost is a community of healthcare innovation enthusiasts, people like yourself and myself, engineers and nurses and people who work at big pharma and insurance companies, people who want to see something better, right? And it started when Eugene Barakovich, who's actually now one of the companies we invested in, he runs, but at the time he worked for Medco, and he started a little meetup in a conference room called the New York Health Technology Organization or something like that. Mm-hmm. And then it got rebranded as Health 2.0 as a local chapter. Anyway, so So I go to this because I had just gotten out of women's clothing. I mean, a company that sold women's clothing, and I had been out. So that's another old joke. Um, I got a lot of them. So uh, so I just started this company called Fair Care, which was basically Priceline for healthcare. My name is Alex B. Fair. Anyway, and so I was in the city every day, and so I was like, oh, let me go check out this meetup group. There's people who are into health technology. What's health technology? Now, meanwhile, I've been building health technology like since the '90s, except for that stint of women's clothing. Anyway, so I didn't know anybody in healthcare anymore. So I go to this thing, and suddenly there's 30 people in this conference room, like all talking about health tech and healthcare reform and Obamacare. At the time, it was just called healthcare reform. And so that was very interesting to me. So I kept coming back, and eventually they asked me to run it. And it was the first such group in the world, as far as I know. And then it inspired hundreds of others, and at least a dozen in New York. And we took a hyper collaborative approach. We just sort of helped everybody. Why? Because we had other businesses. It wasn't a business in and of itself. It was just creating a community. And so we found our tribe, and the tribe exploded and what have you. Um, and there was a big national conference back then called the Health 2.0 Conference. It still sort of exists. It was purchased by HIMSS. And they sort of encouraged the growth of the chapters around the world. So it got up to like 218 chapters around the world. Plus, there's other inspired groups or whatever, and we helped everybody. So in 2012, when we opened up our first crowdfunding site called Medstartr, there was a large group of people who said, "Yeah, this is great. We would love this." And the Wall Street Journal wrote about it, and TechCrunch wrote about it, and everybody came to the site. And I had really just created Medstartr initially for Fair Care.
Yeah.
So this company I'd been working on, I'd gotten millions of people to the site, and I just wanted to crowdfund that because honestly, I was tired of just paying for everything myself. I wasn't very good at venture capital back then. Um, and and a ton of people came to the site. A ton of people funded Medstartr. So we put up a video for Medstartr, and like one person funded Fair Care. And it was my cousin, so that really doesn't count. I think it was like $20. And even though Fair Care had helped like thousands of patients get care for less, it helped thousands of doctors, get new patients. Nobody wanted to fund that. So what I learned is that even if people talk, I mean, you've heard people talk about price transparency and pricing in healthcare, and it's whatever. Especially back then, it was a really big deal. So everybody said they wanted to solve the problem, but nobody's willing to pay for it.
Yeah.
At least not directly. I mean, eventually, I think there will be models that enable that. So we just switched teams over to shifted, pivoted, I guess is what people call it. We pivoted to just helping the community raise money, get the attention and traction that they needed. And shortly thereafter, GE came to us and said, "Hey, what the companies that do well on Medstartr," because soon lots of other companies came through. Dave Chase got his start there, Regina Holiday, Fred Trotter, all these people that are common names in healthcare innovation now raised their first funding and got their first partnerships through the original Medstartr site. So it was great. We learned from them. We helped them. We made a little bit of money on it, and then suddenly people started coming to us and saying, "Wow, we'd love to use crowdfunding as a way to figure out which companies are going to be successful." And people who are really smart, people, at GE and HHS and American Heart Association. So we ran a ton of challenges for them starting in 2012, and using the platform as a way to sort of crowd validate from doctors and patients and hospital leaders and whoever, the people who actually know what they're looking at, they would click on the options and say, "Yes, we'd like to try this out." So that was the sort of the genesis of how we got into Medstartr and crowd validation and crowdfunding and running contests. And then later we figured out that the teams that won the contests or did well on the platform were about 20 times more likely to be successful in the marketplace. And if we had been investing, companies like Medable, Misfit Wearables, they all came through the platform. And went on to billion-dollar valuations. So in 2017, I started the first fund just with my own money. And then I brought my brother in the next year, and he brought in a bunch of his friends. And so now we've got a couple $1 million in fund two, and we've invested in 9 companies. On average, they've grown about 3.5-fold since we invested. So that's only about a year and a half. So that's about 10, 20 times better than your average venture fund. So along the way, we sort of accidentally figured out that we've got a better way to do venture capital. So now in our third fund, we're hoping to raise it to be a normal fund size, like $100 million. And the goal is to help the innovators get up faster. It's not just about making money. We're very impact driven. We figure by now we've actually helped hundreds of companies that have helped thousands of doctors, help millions of patients, which in turn have, we figure we've touched everybody on the planet a few times with it's just like, it might be like a little nudge, or just a little training. So that feels really good. And as somebody who was a bench researcher, and then a PhD student trying to cure cancer, to save people who are already dead, in my family, as I'm sure a lot of us get motivated that way. I think my grandmother and her two sisters died of breast cancer. I said, well, I'm not going to do physics anymore. I'm going to go try to cure cancer. But now this is even more satisfying because it will be a digital therapeutic that will work better than prednisone for people with lupus to prevent recurrence. And how many people is that going to help? It'll also reduce the cost of care because they're going to stay out of the hospital and they're going to be healthier. They're going to be able to have babies. And they're not going to be hungry all the time. They're not going to gain 10 pounds. They're not going to die 10 years earlier, because they're on prednisone. So that feels really good to me. It's like the top triangle of my Maslow's hierarchy of needs. It's self-actualization that I get to actually help so many people with just my unique approach, and not just me, but people like you, mentors, and even if they get interviewed on your podcast, that will help them raise awareness. So it's a very dynamic kind of system. There's over 900 mentors in our mentor network, people like you and many of the people you've met, Tisha Patel and Aditi Joshi and Samantha Nazareth, and all these people who are just really smart, really capable, and get involved in healthcare innovations. And being able to connect those people is very satisfying. It's not me, it's the crowd. It's funny when people say, my pronouns are, he and her or whatever. My pronouns are we and us. Because it's not what I can do. It's what we all do together.
Yeah, that's cool. It's really cool to see how you've grown and how you've evolved over time. And I think it's just a testament to the way the whole process, right? It's about the journey. And, some people are hoping, people who are working on their first company think, oh, I want this to be the best thing since sliced bread, but it may not always be. But you never know what the next step will be, what opportunities will come your way. So I don't know. I think it's a testament to entrepreneurship.
I remember, so after this company that just gone public bought my first company, we all piled in the first day on the job, we all pile into a limousine, and I'm with all these, executives, the whole board, because I was younger than by 25 years, but I was the only one to really understand computers. And they had been buying physician practices. This is called a physician practice management company. It was actually a really big thing in the 90s.
Yeah.
Back when you were in grade school, right? Anyway, it's okay. Anyway, and I remember David Giacaruso said to me, he's like, I'm going to convince you not to go into medicine, because medicine, he was like a good fella, because medicine, it's not so great anymore. It's like they just work for you. I was like, well, we'll see about that. And he was right. By the end of the summer, I had, anyway, but I had considered not. But it was an interesting statement, and he was definitely right.
Yeah, I definitely think that physicians are trying to take control back of medicine in many ways, and there's numerous ways people are trying. Leah Houston is working on a digital portal system called HPEC, which would, I guess, be an online portal for physicians where they'd be able to place all their credentialing information.
Yeah, she wants to use blockchain credentialing. She won a pitch contest, Mission Physician Transition, on June 18th of 2018 at one of our events in New York. Yeah, I know Leah.
Yeah, yeah. So
And
yeah,
she's come a long way. I mean, and she did well in that event. We didn't invest in her for various reasons, but I know that her approach was to get physicians to invest.
right.
But we wanted to see her build a little bit more out. It sounds like she has, so that's great.
Yeah,
We
and
miss,
also,
we miss a lot of opportunities just because we're a little more cautious than perhaps we should be. But
no, I mean, it's understandable. I mean, I think that like her, but even other people, just in terms of individuals, people are establishing side gigs or they're establishing another business or they're exploring hobbies. I mean, there's a doctor who builds like doll houses on the side, and she was featured in a bunch in on the news and in magazines, recent featured nationally for these doll houses that she's building for children, and it's just like amazing to see the detailing that she has.
yeah, OCD is a really wonderful thing if channeled into the right directions. One of my
Exactly.
favorite neuroradiologists is so OCD, but if you need somebody who's going to find that, slight, tiny little, bleed,
Yeah,
he's your man, you
yeah,
know.
exactly.
But yeah, if that could be channeled into dollhouses too, and that is why we run events like Mission Physician Transition,
Yeah.
right? So you'll have lots of physicians who are just tired of whatever they're doing. There seems to be a preponderance of gastroenterologists. Don't ask me why. Anyway, so actually, in that particular case, like 3 or 4 of my physician friends and people in the network had said, I really want to get out of blah blah blah, and I was like, well, let's put together an event for that. And yeah, that's kind of what we do. We kind of crowdsource how we're gonna do things.
Yeah, Sam Nazareth is a gastroenterologist.
Yeah, she was. I actually met her at that event, and now she's the chief medical officer for some startup. I don't know. I don't talk to her that much anymore.
Yeah.
But yeah. So she's a perfect example of what happens, when you come to our events. And Leah, that was the same event that Leah won the pitch contest at.
Oh yeah, that's so cool. So I know this is a very general question, but I ask this to most of my guests. So fast forward 15 years, how do you see technology changing the way we practice medicine? Um,
Oh my God. I should have recognized that was coming because I don't know if you know. Remember, I ran all through. I get so sick of looking at the dumpster fire that 2020 was.
yeah.
Um, Instead of doing 2020 related things last year, like mid-year, I switched over to this challenge we called the 2021 Vision Challenge. Initially, we were going to call it 2020 Vision, which would have been much funnier,
Yeah.
but nobody wants to look at that. So anyway, and the promo was like flying cars and stuff like that.
Yeah,
And
yeah,
anyway, and actually, their Cadillac did demo a flying car the other day, which is really insane. So I just like to say that I said it first. That
yeah.
it would happen in 2021. Anyway, so we saw all these really great things, and we're always seeing new ideas, but in particular, it made us think a little bit more about what's going to happen. So I mean, I definitely think you're going to see as general AI has really grown. Um, you're going to see that applied. And there's so many tools for AI now that were not available 3 years ago. I think AI now is going to be like databases were like 30 years ago. It's like everything's going to have AI built in. And so what does that mean? That means that instead of, having to go look it up on PDR or, YouTube or whatever, you're going to have something that's listening all the time and is going to say, hey, Dr. Kundra, so you might consider doing blah, 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 right? And that is going to be such a helpful thing. I mean, you always think of the Minority Report and that heads-up display that Tom Cruise had. That's going to be real,
Yeah.
and it's not going to be that long. We've seen a lot of things that are making that possible. The emergence of XR and AR and VR, of course, in care settings. Obviously, coronavirus has made us all, telemedicine enthusiasts, whereas, telemedicine took, 30 years for anybody to want to use it other than radiologists.
Yeah.
Um, and now everybody uses it, right?
Right.
So chronic care management, usually a side gig now is the main event in a lot of cases. And what we're seeing is that the payers are adopting cost saving, access improving, quality improving solutions that actually don't even involve doctors. Something. So one of our companies is that digital therapeutic I was referring to before. It's called MyMe, MYMEE, and they're written into insurance contracts for anybody with RA or lupus, and now even long-term COVID issues for treatment of autoimmune disease. And it works better than prednisone. Why? Because when you are with the patient all the time, capturing all the information about their environmental exposures, about what they're doing, about what they're eating, and you have a functional medicine specialist in the back end, so not a physician necessarily, a lower cost provider that can help out, looking at the data with the help of AI, saying, well, it might be this, you probably shouldn't have had, rose hips or whatever. That seems to be the thing that triggered you for your latest lupus episode. And it works really well. And that's important too, because there is a shortage of physicians, and physicians that are there are getting burnt out and leaving, and committing suicide at a really high rate. And, so you all need help, and help is on the way.
Yeah, we do need a lot of help.
Yeah.
The other the other question I had for you was someone who's interested in healthcare tech. What piece of advice do you have for them?
So I have this, if you look back in 2013, I did a talk at Stanford called Geek to Freak to Hero. And it's about the path, right? So you're a good example, Anita. So you are excited about health tech, and you want to, get the word out and start talking to your colleagues about it, but you really know medicine well. You got a good day job. And so let's say one day you quit and become a podcast host and just talk to health tech enthusiasts and innovators. And so when you do that, everybody's going to think you're a freak, right? But then when you get your own TV show, and it's all about health tech, and the teams that come on, are risen up, and they can go ahead and, change the world, you're going to be a hero to so many people, right? So where are you on your geek to freak to hero path, right? And a lot of us, I know thousands of people who have been on it and what have you. My first step was going to a meetup. Now you can't go to meetups, but now you invited me to something called Clubhouse the other day, right? So Clubhouse is the new meetup in my view, right? So it's a place where people convene and gather and talk about whatever they're interested in. The second thing I would say is go ahead, so find places where people like you are there. Find your tribe, right? So if you're in New York or wherever, join Medstartr.nyc. It's a meetup group, and even though we don't have events yet, we will soon. So one of our companies has a COVID vaccination app that's being rolled out. So we're going to start doing it's called Safe Health. We're going to start doing safe events just for people who are vaccinated.
Count me in, buddy.
Absolutely. Is the first one a mission physician transition, or should we do Dance Dance Healthcare Revolution?
Can we do like a combination of both?
Actually, that actually was Sam Nazareth's idea, to be honest.
Oh,
but,
awesome. Great minds.
Well, no, she said that we should do an event which had dancing. And so, 6 texts later, I was like, what about Dance Dance Healthcare Revolution? Because we already did events called Healthcare Revolution. Yeah. So it was not a big stretch, but we've done them 2 years now. They're fun.
Yeah.
The last one, that's why, people say, why do you have a disco ball in your house? But it's left over from the last Dance Dance Healthcare Revolution.
Oh, wow. I didn't know that. That's funny.
Yeah. Well, doesn't everybody have a disco ball in their living room?
I got to look for mine,
I actually have 2 if you want to borrow one.
Okay, I'll let you
know. So anyways, what was the question? Oh yeah. So what should they do? The second thing is really go deep on whatever your area is. So many times somebody will come up with an idea, and they'll say, well, I'd love to use, step tracking to be able to figure out who's being fit. And then maybe that'll, help them reduce their insurance rates. Well, go look it up, because that's been done, and it's been done pretty well, and it's well done. So keep iterating, keep thinking, keep researching. This internet thing is very useful for lots of things. One of which is figuring out which ideas, can or can't be done. Before I started Fair Care, I researched 13 other companies that had tried to fix price transparency. And before I took my foray into this very difficult space, I at least was informed by all of the reasons that they failed. I even like would call up the founders and say, hey, what happened there? And, it's I still failed, but at least I had a better chance by not making the same mistakes, or let's just say making different mistakes.
Yeah. Yeah.
And I
No.
guess that would be the third thing is, don't be afraid to make mistakes.
Yeah.
And I mean, we made a terrible mistake yesterday. We did a pitch contest on Clubhouse, and it's the second time we did it, but we ran it directly against another big healthcare event on Clubhouse, and it wasn't that well attended. The teams were not that strong, and we shut it down after an hour and a half. Now, the first one lasted 3.5 hours because we did it 11 in the morning, but we had noticed that evening Friday events seemed to be more successful. So we said, let's try evening Friday, and we were wrong. So anyway, but don't be afraid to fail. Just make sure you keep learning and don't give up.
Yeah. Well, thank you. It was so great to have you on here today. I really appreciate it. And can you tell the audience where they can find you?
Very easy to find. Anything with the name Medstartr on it, Medstartr, is related to us. You can also be welcome to email me, alex@medstartr.com. If you want to go to the local events in New York, it's medstartr.nyc. If you want to invest in our fund or see our portfolio, it's medstartr.vc. You get the idea. If you want to do crowdfunding, it's medstartr.com.
Awesome. Thank you so much. It was a pleasure to have you on today.
Thank you for having me, Mita. This is a lot of fun.
Yeah, it's fun. And we'll do a Clubhouse event soon. I haven't actually utilized it as much as I should have. But
I was so addicted in the first month. First week, I think I was probably on it for like 80 hours. But it's a little calmer now, But it's almost cathartic. And actually, one of the first topics that kept coming up was physician burnout and physician mental health. I mean, literally 3 or 4 conversations sort of just like went sideways into that space, and it just highlighting the need of what happens when you get a bunch of us together, and it's an amazing platform. I would definitely recommend it, but it can be a total time suck. So
yeah, I know. Well, thank you so much, Alex. It was awesome to have you on today. I'm going to stop recording.